Hello, everyone. I'm Stephanie,
And I'm Janet.
and this is our presentation on infant pain management using oral sucrose. So, the question is, do babies feel pain? Indeed, babies do feel pain. Babies perceive pain the same way adults do through internal and external stimuli.
Why would an infant have pain? Reasons why an infant can perceive pain are some of the same reasons why anyone else can perceive pain. The difference is the ability to verbalize what they are feeling and where. Some of the reasons are blood draws or punctures of any sort, dressing changes, NG tube insertions, injections, and many others.
So, what is sucrose water? Sucrose water is basically sugar water which is used to relieve pain in infants. And the usual amount given per procedure is 1 milliliter, which contains 24% sugar solution. This sweet solution helps reduce pain in neonates and infants through a taste stimulation of the cellular membrane receptors in the brain, which is where the endogenous opioid system is located. Also, the reason that sucrose water is given orally is to enhance its calming effect on the baby. Pop quiz. Question number 1. What is or are reasons why an infant can experience pain?
And question number 2, why is the sugar percentage per milliliter of sucrose solution? So the answers will be located at the end of the presentation. Stay tuned. Dosing. Here is a chart that indicates dosing ranges in regards to infant age, suggested incremental doses, and suggested dose amount. To administer sucrose water, you need a doctor's order. The 6 rights of medication administration also apply to this. So you'll need to check the right patient, right medication, right dose, right route, right time, and the right documentation.
So, why is it essential or necessary to treat pain in neonates and infants? One of the reasons is that if pain is left untreated, it can lead to decreased oxygenation, which means that the baby does not receive enough oxygen to the brain. Another reason is hemodynamic instability, which occurs when there's an abnormal or unstable blood pressure, which may result in inadequate blood flow to the infant's organs. And another reason is that there could be an increased intracranial pressure, which means that there's a rise in pressure around the baby's brain, which may be due to an increase in the amount of fluid surrounding the infant's brain. And another reason why it's essential to treat pain in neonates and infants is to decrease the behavioral distress that neonates and infants experience. And some of the signs that the babies will show is tachycardia, which is an increase in heart rate, tachyapnea, which is increase in their breathing, hypertension, which is an increase in their blood pressure. The infants' pupils also dilate, and they have a pallor-looking skin tone, which means they have a pale skin tone. And also, there's increased perspiration, so increased sweating in the baby, and increased secretion of stress hormones such as catecholamines and cortisol.
Other methods to consider. These include non-pharmacological ways to manage pain. The most potent of them is distraction. Methods that help calm an infant include breastfeeding, using a pacifier, skin-to-skin contact, swaddling, touch, and talking or singing to the baby. These are all distraction techniques for pain management. But best of all these mechanisms help comfort and calm a baby when they feel they are in danger or in pain. In fact, Without sucrose water is given after all these measures have been established without desired outcome.
So pop quiz question number 3. What happens physiologically if pain is not controlled?
And question number 4, what is the best non-pharmacological remedy for infant pain? And again, these answers are located at the end of the presentation.
So what are some contraindications and reasons to be cautious when using oral sucrose for infants? So the infant can develop sucrose intolerance, also known as sucrase isomaltase deficiency, which is known as CSID, fructose intolerance, glucose galactose malabsorption, and also the neonates and infants' muscles can become too relaxed, which could be dangerous to the baby's health. Also, it's not recommended to use the oral sucrose outside the hospital for the following reasons. It could have serious side effects if given incorrectly, due to if the mixture has too much pure water, there could lead to an electrolyte imbalance, which may occur, which could lead to seizures in severe cases, says Dr. Fisher. And if the body gets too much water, the sodium gets diluted, causing the electrolyte imbalance, which causes tissues to swell, which could lead to a seizure or even put the child in a coma state.
So here are your pop quiz answers. And this will conclude our presentation.
Thank you for watching, everyone.